Welcome everyone. Today we're talking about a very special topic, and that is the topic of sunlight. One that is not often looked into, and we sometimes give it for granted. But I tell you, it's a real blessing. As you know, we have been going through all of these pillars of health, and I know that you'll be blessed as we continue this journey. For those of you that don't know about myself, my name is Pedro Naranjo, and I want to tell you a little bit about myself. I'm a firm believer in God's Word and a follower of Jesus. Why do I tell you that? Because along the latest clinical research that I'll be sharing with you in this particular lecture, I'm also going to be sharing with you the amazing promises of God and the blessings that He has for you. I've been practicing the health message for more than 23 years. On the area of technology, I'm a solutions architect for an IBM product called CBQ. On the area of health, I am a certified health coach by Dr. Seal's Wellness Institute. I also did 3 specialties there. Also a member of the American College of Lifestyle Medicine. I did also my studies as a master herbalist in American College of Healthcare Sciences. But above all things, I have been blessed with my beautiful wife Maria and 2 children, and we enjoy sharing with others the amazing blessings that He has for us, now especially in the topic of sunlight. Now, this is something very important. We're going to cover in each one of these one by one, making sure that we are all covered. Why is sunlight so important? Well, it helps us regulate mood. It helps prevent depression, supports better sleep, strengthens bone health, enhances immune function, improves skin conditions, lowers blood pressure, and may reduce the risk of certain cancer. Does it sound like a good package? It does to me. So let's go right into it and see what God has prepared for us. Now, if you're new to some of the lectures and the things that you're watching here, you will notice that above in the screen, in the part that I'm reading, or at the bottom, you will find either a reference or the full URL. And that is to give you the reference of where I gathered the data, whether it's the clinical study or the article that was published. This is very important so that at the end, as we go through, you'll be able to then share this with a healthcare professional, say your PCP, and be able to let them know that this is not just your opinion, this is well-researched data that you can actuate upon and be able to get better health. So let's get right into it. So sunlight can help you boost your mood and well-being. Before we get into reading the data, I don't know if it's happened to you, but sometimes you walk in the morning where the sun is just shining and you just kind of expose your face to it. It gives you this sense of well-being. Have you guys done that before? And that is such a blessing. And that is because your body is literally reacting to that sunlight that you are assimilating through your skin. So, sunlight can help with the boost of mood and well-being. Exposure to sunlight and darkness naturally triggers the release of hormones in your brain. Daylight exposure is believed to increase the brain's production of serotonin. And that is a hormone associated with improved mood, calmness, and focus. In contrast, at nightfall and as the light dims, your brain begins to producing melatonin, a hormone that produces restful sleep. And there is this circadian rhythm where you have cortisol versus melatonin. Those are the two that changed a whole lot. And we'll be talking about that a little bit more. There is something called seasonal affective disorder, which now is actually categorized as something like depression in a sense, but that's how it used to be. And so without adequate sunlight, serotonin levels may drop, which would increase the risk of depression. Specifically, major depressants with a seasonal pattern, formerly known as seasonal affective disorder or SAD. This type of depression is often linked by the changing seasons and reduced exposure to natural light. And it happens mostly in females. It's something quite interesting. Not only do they have to deal with the whole hormonal change, but also the lack of sun could actually then create the SAD disorder as well. So it's very, very important that we pay attention to the sunlight. Well, I can't say that I can relate, but at least I've read it in the studies. There is, of course, PMS, right? And all ladies are aware of what that is. But that there is something called PMDD, and this is premenstrual dysphoric disorder. And according to the research, that is like taking PMS and putting it in steroids. It's just horrible, plain horrible. But according to research, it may affect women in childbearing age. It is a severe and chronic medical condition that needs attention and treatment. And of course, when we have enough sunlight, it could actually benefit with PMDD. It will help pregnant people with depression, women, of course, and anxiety-related disorders, panic attacks, that has been also linked with changing seasons and reduced sunlight. And so you will find that there is a commonality in all of the lack of sunlight, and that is lower levels of vitamin D. This is the common factor that you will find across many other things as well. But this lower level of vitamin D has a huge list of ramifications as it goes through. Very important that we pay attention to that vitamin D. We'll get to that in a moment. You'll begin to see it some of it. Sunlight can also help us build strong bones. Exposure to the ultraviolet B, there is A and B, waves there. Radiation of the sun causes a person's skin to create vitamin D. According to one study from 2008, a 30-minute period while wearing a swimming suit, people will make the following vitamin D levels: 50,000 IUs if you're white skin, 20 to 30,000 if you're somewhat tan, and 8 to 10,000 if you're dark skin. And this is because the sunlight has to interact with the level of cholesterol that is in your skin. And so if you have darker skin, it cannot have that interaction as often or as easily as if you are a light skinned person. Vitamin D plays a big role in bone health. Low vitamin D levels have been linked to rickets in children and bone wasting disease like osteoporosis, and that's a medical condition when the bones became brittle and fragile from loss of tissue, or osteomyalgia, softening of the bones as well. It's very important that we pay attention to that vitamin D. Cancer prevention. This is so important because sunlight is linked with your vitamin D status. Cancer is also involved. And sometimes, when we talk about cancer, we think there's some mysterious thing that is up there. But your body actually produces more than 10,000 free radicals a day. Every single one of those free radicals could turn into cancerous. Because a cancerous cell is basically a cell that is not normalized, that is being damaged, like the free radical, that is missing one of those electrons in its ring, and now is literally looking to get that from other cells, and it unbalances everybody. Antioxidants, by the way, are ones that have extra in their rings and can share and happily be able to normalize those free radicals. But it is the job of the immune system to be able to take care of those free radicals for you. So when we look at cancer prevention, sunlight can be a real blessing. According to the research, those who live in areas with fewer daylight hours are more likely to have some specific cancers than those that live where there is more sun during the day. And this cancer included colon cancer, Hodgkin lymphoma, ovarian cancer, pancreatic cancer, and prostate cancer. So in essence, when we don't have enough sunlight, it could definitely affect how our immune system responds. And of course, cancer could take advantage of that situation for something that is not good for us. Well, it could also help with health conditions. I'm sure, you don't see it as much here, but if you're from the islands, I was born and raised in Cuba, you see those big old iguanas. And what do they like to do, or where do you find them the most? Have you guys seen, or do you guys know, according to the pictures or the things like that? You find them basking in the sun. They're just taking the sunlight, basically. And they do that because when they have the certain parasites that as they expose themselves to the sun, it kills them and it helps them to calm down. And it's such a blessing for them. But it's also a blessing for us. According to the WHO, sunlight exposure might help treat several skin conditions too. Doctor has recommended UV radiation exposure to treat psoriasis, eczema, jaundice, or acne. While light therapy isn't for everyone, a dermatologist can recommend whether the light treatment will benefit the specific skin conditions. So in essence, sunlight has been used to also help treat certain skin conditions. That's why I was in Guatemala not too many months ago, and we were out into the interior, about 3 hours away from the main capital city. So we were doing health clinics there. We had a large team of doctors and providers. I think we had 8 providers and 3 dentists, plus nurses and the rest. And I was doing lifestyle consultations as well with natural remedies and such. And I came down to help with something else, and there is a couple of cases there that the doctors were recommending because they didn't have anything else to help treat it there in their arsenal per se of medicine that they brought. And one of these ladies had large ulcers all around her foot. And so as I give some indications to the nurse that was working with her, I asked him to, debride the wound and make sure that it was well bathed with hydrogen peroxide, which we have acquired there. And after that, I asked him to expose it to the sun for an hour before we went on to dress it with actually honey and later on with a charcoal patch. So that's very important. Why? Because the sun would not only dry the wound, but it will also help kill the bacteria. So exposing the wound to the sun is very, very, very beneficial for each one of us. And we are told the same. Now we come down to that vitamin D and why it is so important. Now, vitamin D is sometimes called the sunshine vitamin because it's produced in your skin in response to sunlight. It is a fat-soluble vitamin, and it's a family of the compounds that includes vitamin D2, which is the plant-based, a pre-vitamin D, and vitamin D3, which is the animal version or the active form per se. Your body produces vitamin D naturally when it's directly exposed to sunlight. This is why we have to go out there and expose ourselves to the sun. If you have a job where you work outside all the time, you don't have to worry about it. But if you work inside the office, you got to get yourself out there and expose yourself to the sun. Very important. You can also get it through certain food and supplementations, and we're going to talk about that, especially if you're low levels. Vitamin D has several important functions, perhaps more vital as regulating the absorption of calcium and phosphorus, and facilitating the normal immune system response. This is key. So remember that whole cycle. Low sunlight gets us low vitamin D then compromises the immune system, and it could give you soft bones. Why? Because it actually interferes or it is not able to absorb the calcium and phosphorus that you need to be able to build your bones. Getting sufficient amount of vitamin D is important for normal growth, of course, that part of that bone growth, and the development of bone, teeth, as well as the resistance to certain diseases. If your body doesn't get enough vitamin D, you are at risk of developing bone abnormalities such as soft bone, osteomyalgia, or fragile bones, which is osteoporosis. Very important that we keep that in mind. Okay, continue on. Vitamin D now gives us, and I don't know, I think this is a duplicate of that. No, let's move forward. So here you go. Here is a list of things that you get when you have vitamin D and when you don't have vitamin D. And the reason why I like to read through this is because sometimes you find yourself having these things and you're wondering, well, is there something else wrong with me? And it could be as simple as just simply not having enough vitamin D. By the way, is one of the most misdiagnosed and underdiagnosed things overall. Sometimes you actually have to plead with your physician to say, could I please get my vitamin D level? And even when you do get your vitamin D level, they will tell you, well, it's within range. However, the actual gentleman who discovered vitamin D, he published a book, and all the data, he's still alive. He was also the one who discovered the treatment of psoriasis based on the vitamin D research that he did. And he lets us know that the data has unequivocally shown that what we call normal today, which is about 30 to 40 ng, is absolutely not enough. You actually have to be somewhere between 80 to 100 or 60 to 80 if you want it to be more in the subpar range. So very, very important that you look into this and have a proper discussion with your physician to make sure that you're not passing on to this benefit. So what do you get when you get vitamin D? Well, vitamin D helps you fight disease. It helps you reduce depression. Very, very important. So if a particular person, especially ladies, are dealing with the issue of depression, look into the vitamin D status. It might boost weight loss. And people say, really? Well, yes, because not only does it play a role with the immune system, but it also plays a role with the hormonal level of the individual. And so as it helps with the hormonal level in the endocrine system, it's able to then regulate metabolism, which would then be expressed in your weight loss or weight length. So in one study, people taking a daily calcium and vitamin D supplementation were able to lose more weight than subjects taking a placebo. The scientists said that extra calcium and vitamin D has an appetite suppressing effect. And so that's for the research in that area. Now, what happens when you don't have enough vitamin D? Well, you're tired all the time. You have general aches and pains. And there's a general sense of not feeling well. Okay? What else could happen? Well, you have severe bone loss or muscle pain or weakness that may be difficult to climb stairs, getting up from the floor or low chair, and it will cause you to walk in a kind of with a waddling gait. You are more susceptible to stress fractures, especially in your legs, pelvis, and hips. And this doesn't show up in the earlier years of life, but rather in the latter years of life. So you're most susceptible to this kind of things. All right, let's go right into now one of the herbs that we can study. And as you know, this part here tells you that I am not your doctor. I am not a doctor. I'm an herbalist. And my part is to help you learn about herbs and connect with Jesus Christ, who is the ultimate healer that could be a blessing to you. So we're going to talk about anti-inflammatory and pain relief. Why? Because when we look at sunlight or the lack of, pain and general aches and pain is one of the things that people experience. So what is a good anti-inflammatory or pain relief? Well, one of the most potent one is basically turmeric or curcumin, which is the active part of turmeric. And this part, of course, is in Spanish. You might not be able to read that. That was a mix from one of my slides, but here's what it says. It says that in a trial of more than 1,258 people, they found that it was increasing or able to help with their pain for more than 95% of the people that were able to achieve that. And that was a real blessing. All right. And this one, back to English, so this is a lot easier to follow. A randomized clinical trial involving 45 males and patients undergoing a hernia and other types of treatment. After taking 400 milligrams of curcumin 3 times a day for 5 days, they show significant reduction in total inflammation score by 84% compared to 86% of those receiving a regular drug. And the reason why this is important, you might say, wait a minute, the percentage is comparable. Well, that's the point. It works just as well as the regular drug. Okay? But what is then the benefit? Read on. The study concluded that curcumin was nearly as effective as the drug in reducing edema, that's overall water retention, tenderness, and pain without the associated gastrointestinal side effects. That's the key. So the key here is that there is a natural alternative that you can take that could be a real blessing without the nasty side effects. And let me tell you, if you have taken pain medication before, let me tell you there are some pretty strong side effects. You might find yourself completely blocked and not being able to move your bowel movements and such. And that, as I was told by one individual who was in such position, I don't know what hurts more, the pain or now not being able to evacuate. And so you want to pay attention to these things and be informed of the things that are available to you. So here are the references to the clinical data. Why is this important again? Because when you talk to your physician, bear in mind that your physician has never studied this data. None of the educational curriculum of your physician includes any of the data that has been well documented that is available as clinical data in this arena. It includes all of the pharmaceutical, but it does not include natural remedies or natural substances. So this is important so that you can share with them that this is based on clinical studies and data, and it has definitely good basis for it. All right, so how do we use it? There are a couple of ways of how to use it. And so there is something called the golden paste. And so this is excellent for absorption. This is a way that you can use it internally. I recommend that you take a quick picture if you like the recipe that is there to kind of follow up. But it is basically a very simple way for you to do it and get it on from that part. So if you like to take a picture, I'll let you take it for a moment. And then we'll move on because I have other preparations as well. All right, very good. Let's see if we can get the next one. Okay, this is also internal, and this is a way for you to be able to pretty much follow the same. I'm sorry, I think that's the same as this one. This is the other one that we have here. This is external. And what this allows you to do is put it topically instead of taking it internally. The prior one was to take it internal. This is to apply it topically. If you had an area where you had inflammation, let's say you had a bite or you have any areas where you wanted to take down the inflammation, you can make a poultice or this particular paste, and it will be a real blessing. So I'll let you take a picture if you like before we move on from that part. Very good. All right, so we talked about the herbs, we talk about things that are important for sunlight, but listen, how do we make this practical? How do I incorporate enough sunlight into my lifestyle? Well, before we talk about incorporating just the sunlight that you're exposed to, we have to talk about knowing your vitamin D levels. If you do not know your vitamin D levels, you got to make it a point to go and check. It's a simple check. I'm not sure here in British Columbia or Canada how it works, but in the States, there is a website called health1labs.com, and you can literally go there, order your own vitamin D check, and you can just go into any of the labs that they have nationwide, and you can just have the check right there. You don't even need to walk into a doctor's office, and it's very affordable. So you got to know your vitamin D level. Why do you need to know? Because just guessing will not allow us to truly know if you are in that condition where we need to take larger amount versus just the regular maintenance amount. So if you are low in your vitamin D, you have to take a much larger amount. We're talking about 50,000 IUs per week. Rather than if you're just doing maintenance, you could be somewhere between 5,000 to 10,000 IUs. So you got to make sure that you know your vitamin D levels. And a very simple way to do it, it's about taking 10,000 IUs for 5 days or every weekday, and you will be blessed to see the benefits of these things. We normally as a family get it from Amazon, and they have vitamin, there's a D3 and K2 together. And so they're a lot easier to take like that. It's an MCT oil, which is a lipid base. Why? Because vitamin D is lipid base or is fat soluble. So you definitely want to do that there. How else could you expose yourself more? Well, you can take a nice little walk after your meals. This is a practical way for you to actually help that digestion get going and be able to enjoy some nice time. So taking a little walk after your meal will be an awesome thing. And of course, doing activities outside. Gardening, walking, talking to friends, walking the dog, whatever it is. But being outside from 15 to 30 minutes, exposing your face and hands are the primary thing that you want to definitely keep in mind as you do that. Now, it is very important that as we look at these things, we take a moment to take action. You know, we come from a long way. We want to spend this with you. And now I want you to take a moment. I'll give you 30 seconds to think, when am I going to get my vitamin D test done? And how could I incorporate these items there into my lifestyle? So I want you to give you 30 seconds. I'll pause. I want you to think those two things. Please jot it down in your phone. Make sure that you choose that time in your mind, because sometimes we hear these things, but we don't put them in practice, and that's not a good thing. So we definitely want to make sure that we put these things in practice. I'll give you a couple more seconds, so you have your full 30 seconds. Please think about when are you going to do that, and I'm sure that there will be ways that that can be done here. All right, very good. Let's move on. All right, I wanted to show you a demonstration, but I think we're gonna skip on this one. Rather, going to give you this amazing story of God's blessing in the sunshine, even in the hospital. And the reason why I say even in the hospital is because sometimes, or most of the times, if you are hospitalized, there are two things that you normally don't have access to, and that is sunshine, and what's the other one? Air, fresh air. That's right. You get all of your air filtered through a machine, a system that filters the air of the hospital. Not very often do you find the opportunity for you actually to get fresh air into your room. And so let's talk about what happened here. Well, the research at Cornell University wanted to find out if something as simple as sunlight in the hospital room could impact the well-being of patients and their recovery. And so this study, patients, 89 of them, recovering from spinal surgery, was split into two groups. Group A, rooms with natural sunlight. Group B, rooms with artificial lights, no direct sunlight, okay? So what did they discover? Well, they discovered that they had less stress and anxieties for patients in the sunlit rooms, felt calmer and less anxious during recovery. They also discovered that these patients needed 22% less medications. I mean, you're talking about just being in the sunlight after you had surgery recovery. And this is in a clinical study, so it's not just Pedro's making up his cool idea of how it works. This is in the clinical study. So they needed 22% less pain medication than those in artificial light rooms. They have faster recovery time. They heal more quickly and have shorter hospital days just being exposed to sunlight while in their hospitalization. I don't know about you, but I definitely praise the Lord for that. Something as simple as just being exposed to the sun could be a blessing. So this demonstrates that natural sunlight enhances healing, reduces reliance on medication, and supports emotional well-being. All right. We wanted to end with this. This is a beautiful promise of Malachi 4, 1-3. As I walk in my property, I'm able to see the sunlight, or the sunrise, This is a promise that totally comes to mind. It says, for behold, the day comes that shall burn us an oven, and all the proud, yea, all that do wickedly shall be stubble. And the day comes shall burn them up, says the Lord of hosts, and it shall leave neither root nor branch. But unto you that fear my name shall the Son of Righteousness arise with healing in his wings. And you shall go forth and grow up like the calves of the stall. You shall tear down the wicked, and they shall be ashes under the soles of your feet in the day that I shall do this, says the Lord of hosts. What a beautiful promise. So when I see the sun shining in the morning, it reminds me of the Son of Righteousness that brings healing in his wings. And this is a promise from God's word that can give us encouragement and be able to take us forward as we move ahead. All right, so we're arrived to that time where you can actually ask your questions, if there is any. Any questions that you might have about the data that we discovered so far, or about any of the areas of natural healing that I can be of help with. Anything? Yes, sir.
In one of the first slides, you showed sunlight, the benefits of sunlight and darkness.
That's right.
Comment on that, please?
Yes, what happens is our bodies regulates the circadian rhythm by the exposure to sun and by the exposure to darkness, meaning when there is no sun in the night. And so the circadian clock controls cortisol and melatonin. At 6:30, if your clock is right or set up correctly, at 6:30 a.m., your cortisol increases, melatonin decreases. That says, hey, time to wake up, time to get going. And so that's natural. That kind of keeps you up. And that is normally triggered by sunlight. Okay? Normally around that time, the sun is full in view, and it is able to trigger that. Now, in the night, in the evening, the opposite happens. Your cortisol decreases, your melatonin increases. And that is exposed, that happens as the light dims down. As a matter of fact, that's why when you looked at the rest lecture, I talked about that wind down routine. Well, actually, I'm not sure if we went through it already. I think we did. And that talked about 6:30 p.m. shutting off the phones and the blue light, the screens from the computer. Because that blue light actually keeps your brain awake and it does not allow that shift to happen. So in a sense, the idea here is that if we follow the regular cycle of the day, we should be able to have a proper circadian rhythm that could help us overall have better health. So I keep on saying to people, you got to sleep with the chickens, wake up with the roosters. That's the best method there is. If you follow that, you will do well. All right. Any other questions? Any other thoughts that you might have about sunlight, the thoughts that we talked, or natural remedies in general? Yes, sir.
Sunlight's effect on skin cancer.
That's a loaded topic, but this is a very good one. So we did talk about the fact that...
I'm going to repeat the question for the...
Yeah, that's right. Okay, let me repeat the question. So sunlight effect on skin cancer. So we're looking at something like melanoma or something similar to that. And so when you look at that, sunlight would help with the vitamin D production. Vitamin D would help with the immune response, and the immune could then help deal with the cancer. They actually have done studies with ultralight exposure for skin conditions, cancer, psoriasis, etc., and it responds well. But the most important part, especially if you're sick, especially if you have cancer, is to consider looking at the current data that we have that shows that somewhere between 80 to 100 Ng for your vitamin D status, it's the best range to be in. When you go beyond 100, you get into trouble. When it is below that, you're not running at optimal levels. And so the gentleman who wrote and discovered the vitamin D, he actually wrote 2 books about this, and he has had extensive research, more than a lifetime. That was his focus in vitamin D. He was actually the one who also invented, or not invented, but discovered the treatment of psoriasis with vitamin D as well. And he lets us know that certainly you want to have your levels from somewhere between 80 to 100. That's the ultimate goal. So I would look, if I was in that condition, I will look certainly to make sure that I was within that range and talk to my physician about it so that he will be well informed about it and let us know, let him know how to work in his condition and situation. Very good question. All right, any other thoughts? Any other questions? All right, well, if there are no more questions, that's all right. I wanted to leave you with these thoughts at the end. Please come back for the next lectures. We're not done yet. We still have more to cover. We have covered these beautiful topics that I know have been a blessing to me for many, many years, and I know there will be a blessing for you as well. Consider these things that we have talked about and make it a point to do changes in your life. It does not serve you any good if you just listen to these lectures and go on to your merry life just like before. Rather, examine the data that has been shown to you and make changes in your life that align your life practices with the information that we talked about. Remember that simple things like knowing your vitamin D level, taking a little walk outside, being more active in the sun, making sure that you are exposing yourself will be a real blessing that will give you a lot of benefits. May God bless you, and we'll look for you in the next lecture.